Welcome, everybody. I'm Father John Cusick, and we're beginning the 36th season. Isn't that amazing? Of the First Friday Club of Chicago. And it's an idea that I brought back with me after speaking at the First Friday Club in Cleveland, knowing that I was about to move from my current assignment down to Old St. Patrick's in the heart of the city of Chicago. And it dawned on me after speaking to the First Friday Club in Cleveland that Matt, believe it or not, on the Thursday before the First Friday, that we could do something like that in Chicago. And so we birthed the First Friday Club of Chicago. It began in June of our first year, just to give it a test. Cardinal Bernardine, may he rest in peace, was our first speaker. So we're here today, and this is a new season. And I am just so thrilled that our speaker is Dr. Ezike. My only great regret, and I just see that she has popped on here, is that this is not going to be live in person at the Union League Club, where until COVID has visited the American and human community. Because what I wanted more than anything else was to suggest we all stand and thank this magnificent physician for how she has led us through some of the darkest medical days and some of the darkest personal days of our life since March, I believe March 16th, 2020, the day I got off of an airplane from Phoenix, and the day basically they shut down the United States of America. And through her constant presence in all of our living rooms, dens, bedrooms, wherever it was, this magnificent person with great calmness and tremendous talent, great skill and knowledge, really led us through, educated us, stayed with us, in so many ways held our hands through moments of fear. And here we are, we're not as locked down as we were a year ago, but I just read a report in today's Chicago Tribune that the month of September had the most amount of COVID-related deaths going back to the darkest time of the pandemic. That's in Illinois, related deaths. So, but thank you for being with us. Our late start, that's okay. It's the beginning of a new year, and there's all kinds of bells, whistles, plugs, everything you got to put together here. Maureen Murphy is the president of the First Friday Club, and she is to my right on the screen and to my left in person. So Maureen, we welcome you and take it from here.
Thank you so much, Father. I am so honored to be here today and would be remiss if I didn't just say happy birthday to our founder and chaplain. Happy birthday, Father Cusick. And then, you're welcome. And then let me just again welcome Dr. Ezike. Let me do so formally by providing you with her bio. Dr. Ngozi Ezike is a board certified internist and pediatrician. Obviously, she is the director of the Illinois Department of Public Health. She previously served as medical director at the Juvenile Detention Center. She is also an assistant professor in the Department of Pediatrics at Rush University. Dr. Ezike graduated from the University of California at San Diego with a medical degree. She has a bachelor's degree in chemistry from Harvard and also holds a management certificate from the Harvard Business School. She is a national policy advisor on juvenile correctional health topics, has presented at numerous local and national conferences for medical professionals and youth audiences alike. And I would add to her bio that she has been a calm, compassionate, compelling voice of reason throughout the course of this pandemic. Welcome, Dr. Ezike. We are truly honored to be with you today.
Thank you so much, Miss Maureen and Father Cusick. Happy birthday. And thank you so much for your kind words. And thank you for having me for this really blessed invitation. Thank you so much.
And again, you are so welcome. Dr. Ezike, I understand that you would like to begin with an update on the pandemic. Would you like to do so now?
If you really want to, I don't want to.
Well, in that
I'm
case,
happy to. I mean, just a few minutes, because I really would much rather, have conversation.
Yes.
But, where we are right now, there is good news. So maybe this is an exciting way to start. And again, I apologize for being late. Thought it was for 12:30. When it moved to 12, I was like, I'll try my best. So sorry, really trying to get a lot in each day. But this is such a special invitation. So I'm glad you guys could accommodate my tardiness. No, there is, some good news. We have seen for the last 3 to 4 weeks consistently, if you add up all the cases for the week, it's been less than the week before consecutively now for all of September. So that is good. And so with that, we've seen just the first week where we had a few less deaths than the week before, but September was a very rough week, and due to the Delta variant and that wave of new infections that it caused, to the tune of 20, 30,000 new cases every single week, and hundreds of deaths to go with that, unfortunately. But it looks like we're on the other side of that now. We have some areas that are hotter than others. And in terms of, hospital beds, that becomes a concern. When you have too many people going into the hospital with COVID, then that means even when I have appendicitis and I need to get my appendix taken out, there's still no bed. And so it's great that the cases are coming down, because that means there will be fewer admissions. And of course, we know that the third doses for people who started off with Pfizer, that's now available. And we're strongly recommending that for people who are over 65, anyone in the long-term care setting. Father Cusick is claiming that group. And also people a little bit younger who know they have significant medical problems, which we know have a bad time with COVID. So, and then anyone else who started off with Pfizer who feels, I'm at risk some kind of way. I interact with a lot of people, or I think my condition is serious enough to want to get boosterized, if you will. It's available. So we are just continuing to hope good things, because I feel that this disease is now a vaccine preventable disease, because there are not 1, not 2, but 3 vaccines out there that can significantly decrease your risk of getting sick or dying. So I hope people are getting vaccinated. I know people are taking precautions and wearing masks in the appropriate settings.
Good.
Terrific.
Dr.
Thank you.
Dr. Ezike, I'm proud to say that when they opened it up on Friday to get the booster, yours truly was at Walgreens, and I got my booster shot. I was one of the first people in the bloody United States of America.
Wow. No, that's a great example, Father, and I hope people are taking your cue. That's fantastic. I told my mom too. My mom was like, I have an appointment for Monday. I was like, Monday? You got that's waiting 3 days.
But
I love it.
I believe I've listened to you for over a year. I believe what you say. I follow your advice. And in turn, I've done a tremendous thing. I have followed science in an attempt to stay as healthy as a 76-year-old man can do. And I attribute part of that to the leadership that you've given us. I'm very honest about that.
By the grace of God. I thank you, Father.
And so here we are. You have made an enormous impact in the lives of so many of us, Dr. Ezike. Let's go back to the beginning, if you'd be willing to do that with us. Tell us about your growing up years. Tell us about your faith life, about the folks who guided you. Please take it away. We'd love to hear your story.
I am the proud firstborn daughter of 2 magnificent parents named Levi and Comfort. Levi and Comfort were immigrants from West Africa, from Nigeria. My father came in the 60s, and as was the custom, a few years later, they sent a young woman over, and he held a sign at the airport so that she could meet her husband. And so this lovely arranged marriage netted 4 amazing children. And now they have 5 grandchildren and 40, I get to, actually today would have been, we buried my father last year, but today would have marked their 2021, their 50th anniversary.
Wow.
His 50th anniversary today, their 50th wedding anniversary. So yeah, so I grew up in a loving home. My parents were strong Christians. We were definitely active in the church. Went to both regular services as well as Sunday school. We went to a loving Christian parochial school, which further solidified our principles. I know the Bible, I've read it many times through, and I really think that has been like the anchor for who knew what it was going to be for, but really has been the anchor to keep me sane and together in this most trying of times. And that's what his word said it would do,
That is absolutely beautiful. And I am in awe of the fact that your parents literally met at the airport and sustained this, not just this marriage, but raised, I'm sure, 4 fabulous kids. So who did you grow up on the West Coast in LA? Did I read that correctly?
Yeah, born and raised in Los Angeles. That's where I spent my first years before I took the big step to go to the East Coast for college, which was the first time I had seen snow, the first time I really had to buy a winter jacket or winter boots, because we didn't really have the opportunity to vacation a lot in our home. And so that was like an exciting, the first snow in college in my freshman year, like I was just out there like eating it, like licking it. And it was such an exciting thing. I think all the other kids were like, where is this lady from?
Oh, I love it. And how brave your parents were to say, yes, go to the East Coast and follow your dream. Did they always inspire in you the desire to become a doctor, to pursue medicine?
They absolutely did. It was almost not a choice. I know it was like, the story my dad tells is that, I started walking, almost running at 7 months. And so the doctor was like, we have never seen a child start ambulating at 7 months. And so Dr. Jackson, he always told me about Dr. Jackson, said that this girl is going to be so bright and so athletic. You just watch out for this one. And so my dad said, that's when he said, our first doctor on either side of the family, he announced it then and basically was programming me. If I came home with a 99 on anything, he was like, well, where's the last point? Like, what happened? Like, what is wrong with you? Like, where's that last point? Nothing less than perfection. And he said, I don't believe in aiming for the top of this tree. Even if that's what your goal is, you aim for the sky. Then if you miss the sky, then you'll get the top of the tree. And so he's had this, just custom of excellence and always pushing. And really, I was a straight A student. I was also all California, all Los Angeles in basketball and volleyball, and went on to play sports in college and, still playing today. I think one thing that was so funny is that, I was taking all my, my chemistry and my biology and my physics, and then it was really just overwhelming. It was like, so hard, all these labs, all these problem sets. And so some upperclassmen said, take languages. They just meet a couple times a week. There's no lab. You just talk in class. And so I started taking, Swahili and French and Spanish. And my father was like, what is going on here, future doctor? What is all this? And so I just think that he must be like laughing from heaven, seeing what that Spanish has done, at such a time as this.
Absolutely. And I have to say that what a comfort it was, again, to hear you in your calm, compassionate way, but speak to all of us in the state of Illinois. So let me ask you, you speak Spanish, you speak English, sounds like you speak Swahili. What other languages do you speak?
And then my father's native tongue is Igbo, Igbo, and then I'm fluent in French as well.
Oh my goodness. Is that all? Only 5?
That's all for now, but I have a trip to China planned coming up, so I'm working on that.
Oh my goodness, you are so impressive. So you didn't need a lot of mentors, did you? You were so driven. You were so self-driven. It doesn't sound like you needed people to guide you along the way, but then don't we always?
Everybody
Yes.
needs mentors. We need human mentors. And of course, I really consider my Lord and Savior as the ultimate mentor, the ultimate guide, the ultimate, dispenser of wisdom, because that is really the fountain where I turn to first. Try to start my day with prayer and meditation. I use the YouVerse app and, try to get through the Bible every year. Right now, I am in the second year, still trying to finish another time through. But I just, when I start my morning reading the word, trying to memorize verses, trying to pray over those, like everything is so much smoother, even the hairiest days. And when I don't do it, you absolutely can feel the difference. So I just wonder how people who weren't rooted in faith have made it through this time, because but for God, I don't think I'd be in my right mind or here today.
So it's so great to hear this from you. And I have to tell you that my questions about how were you sustained through the course of this enormous crisis? Where did you find your strength? How did you manage to cope? And you've told us that story, that your faith life has kept you not just grounded, but it sounds like in this calm, peaceful place, knowing that you could lean in and that you would be held. How have your kids fared? I understand.
My kids,
you have 4 kids.
So at the beginning of the pandemic, right, I had, a high school, 2 high schoolers, middle school, elementary. I have four of those people who call me their mom. Sometimes I don't want them to, but most times it's a really good thing. And it was really hard for them, just because not just that I was separated and just so engrossed with the work and just not present to a large degree, even if I was in the house, wasn't available fully to them. But it was also that they were getting the brunt of, well, your mom has caused this, or, we can't play basketball because of can you talk to your mother? And, when some kids were like getting together and socializing, and I was like, no, we really need to stay at home. And they were like, other people, look at my social media. They're all out doing stuff. This really is awful being your kid right now. And so they had to really bear that. It took me so long before I allowed them to have a play date, and it was like outside, and I was supervising, and everybody had masks, because we didn't even know what we were dealing with, and surely didn't want to be, the public health director who was the source of an outbreak that spread into school because she had people congregating outside her home. So there was just a lot of stress and responsibility, but the kids weathered it well. They learned how to contact trace all the outbreaks that happened in their school setting, and they knew how to properly use their mask and knew all the rules and how many days for quarantine and isolation. They're all masters.
Oh, I love it. And I assume at this point, well, maybe not your elementary school child, the 3 older children are vaccinated now?
All 4 was fantastic.
Oh, wonderful.
All 4 are fully vaccinated, and they were just, the one had just turned 12 as it was becoming eligible. And so she was just like, I'm 12. And we're like, oh yeah, we'll do it. No, I want to be the first. I want to be the first. I want that from, so it was very reassuring that they understood the message. And so they could be ambassadors at school about getting the vaccine and promoting it. And then it was a rule that, if your friends are not vaccinated, then they weren't going to come over, and people who were could. And so that helped promote vaccination within their peer groups.
Oh my goodness, I can't believe it. You were walking the talk, that's for sure. Father Cusick, were you trying to get a word in edgewise? I'm sorry, I'm monopolizing.
No, I'm just admiring the story. And Dr. Ezike, when you're talking about your kids and masks, I'm sure you saw the picture of that little boy. It was picture day in his school, and he wouldn't take off his mask because he said, my mommy said I cannot take off my mask. So his school picture, his individual picture, is him with his mask on, smiling through the mask because my mommy said I can't take this off, even for the school photographer. And I thought that's just a wonderful thing. Kids learn, and then they become teachers of others. What a great thing. That's
well,
cool.
and I love that your children were pressuring you. In fact, I understand.
And I saw that. Wise advice.
I'm sorry, you saw that.
I think we got.
I'm going to turn off my video because it looks like my internet is shaky, and so it might be a little better if my camera is off until I get stable internet again. I'm not sure what's happening. Sorry.
Okay.
Well, sure, no worries. So I was just going to ask you. So clearly, you got a little pushback from your kids, at least initially. It leads me to ask you, how did you manage the political pressures of your position? It wasn't just kids who were upset with some of the actions taken.
Yeah, no, that was obviously very challenging, and it was just trying to keep calm and stay graceful under fire, and just speak the science. That I'm not a politician. I'm not trained in politics, so I don't have any way to be but to share what I've learned. And I was a voracious reader of everything that was available to be learned about the disease and about the mitigation strategies that can work. And so that's all I had to play with, and that's all I had to share. So I didn't really get into the politics. The answers were the same.
Could you ever have anticipated this chapter in your life? I mean, you are literally building the plane as you fly it.
Never. And so I just see like that God knew what he had in store and knew where he needed to place his people for such a time as this. And so I am grateful that I leaned into the opportunity that I had to take this job. It was a little bit out of my comfort zone. And so I think being able to lean into that was to make sure that I was situated where I needed to be. And I'm so glad that I was able to be used by our Father in this amazing way.
You know, I have to say, if I can share with you an experience that I had of watching you on television. And it was one of the days when you needed to report, as you always do, on the number of deaths that had taken place. And I will tear up a little bit as I recall that moment. And I just want to say thank you for being your courageous, vulnerable self. You shared with all of us the pain, the sorrow, the difficulty of this terrible time in a way that was so affirming. Let me just say it that way. It was so great to know that we had a public servant in this incredible leadership position who was with us every step of the way. Certainly the science and certainly this difficulty that we were all experiencing. Do you want to comment on that at all?
You know, Ms. Maureen, that was not anything I would have chosen to do. And trust me, there were countless numbers of days of tears, but off camera. And that's where I wanted that to happen. And so when I felt that coming on, I was mortified and I didn't know what I said. You can't just run off the stage. And I just needed to turn around and try to get myself together. And I was so embarrassed. And, you know, after I quickly got off, I was apologizing profusely to the governor. I said, I'm so sorry that I lost it. I was really embarrassed. And he was so supportive. The governor said, please don't ever apologize for being human. And so that support from him, and then the thousands of letters that I got after that was so affirming that it really helped me to understand that as much as they need a person of science, they need to know that they have people that care. And I've always cared. And if that's what it took to show it, then I'm glad that it served for so many people.
You know, I have to say that having your humanity shine through so beautifully has, I think, caused people to respect you ever more. So again, thank you. And that wasn't losing it. That was joining us. That was adding to the beauty of who you are. And I also just want to say, because I have the opportunity to be with you, albeit virtually, I'm in awe. Your energy, your positivity, you are an incredible person. It is such a pleasure to be with you. So I do just want to take a moment to let everyone know, to remind everyone that this is a very special presentation of the First Friday Club of Chicago. We are honored to be with Dr. Ngozi Ezike today. Please know that we will continue to provide free programming of this caliber. And to do so, we ask that you consider a contribution to the First Friday Club of Chicago. And you can find on our website an opportunity to donate. So back to the conversation with you, Dr. Ezike.
Maureen, can I ask Dr. Ezike a question that just popped into my head? Dr.
Please.
Ezike, would you be able to share with us one or two of really the darkest moments that you experienced as we journeyed together through this horrible pandemic? I mean, there was a lot of unknowns. There were a lot of things going on. I remember not so much living in fear, but knowing that I was more fearful than I normally would be because I couldn't go anywhere. I appropriated that and said, this is my life for a while, I'll do it. But it was really a dark place. It was a very, very dark place. And if it was for me, imagine I'm thinking that doctor who stands in front of us, knowing the science, knowing the stuff that's not getting on TV. What's it like for that woman?
Yeah, so, you know, there are so many not positive milestones that, you know, could be characterized as dark. You know, some of it, you know, and you almost hate to go back into the mud, but it's actually, some of it is ongoing. So really, some of it is just the depth, how low some people can go, feeling very powerful behind a keyboard, sending just incredibly evil and awful emails, calling me every name in the book, calling me a murderer, you know, questioning everything. You know, it's fine to question, you know, and say that there might be a different path, but the derogatory insults, people feeling that they could come to my home directly, you know, so those were concerning. And I think, you know, some of the leadership and some of the, you know, not in our state, of course, but some of the leadership that you would see, whether it was around the country federally, and some of the, you know, the comments that actually were very detrimental to the cause and potentially cost lives, with some of the misinformation that was put out. Every time you would hear like a federal, you know, a US senator or congressman saying that we're making such a big deal about this and these deaths aren't real, I thought it was so insulting to people, so many people who had lost people, and not just lost people. One of the darkest things was that these people died alone. They couldn't have their loved one by their side. And maybe the nurse would come. I know of some nurses, ICU nurses, who crawled into the bed with people in their dying hours to give them some measure of comfort. But that's no way for anyone to have to die. And because we couldn't, you know, figure out how to turn this around sooner and followed some of these lies that have, you know, really extended this, I think that's unfortunate, because we have people who are underground that should still be with us.
Yeah, I think you're right. The loneliness thing had to be the hardest. I had to go through that with somebody on the telephone who could not embrace her dad. And I was just broken up because It's just wrong. But this is what that disease has done to us. It's divided the human community on so many different levels.
Yeah.
Wow. Wow. Maureen?
And yeah, if I could jump in. So you said that, Dr. Ezike, you had never anticipated being a professional in a moment like this one. As you look ahead, do you anticipate future pandemics? Can you imagine another one?
Unfortunately, I think we understand better now that although it was 100 years since the last one, I think we know it won't be 100 years before the next one. And so I'm hoping that at the end of this pandemic, we will sit down and take off our politics and take off all of the barriers that try to separate us and really focus on what are the learnings that we need to take away from this so that we can be better prepared as a state, as a country, as a global community to do it better next time. I mean, this pandemic in a time of the most medical innovation has taken more lives than it did in 1918. And so we have to do better. And there are things that we can definitely learn from so that hopefully we can be better prepared. We can have a more educated populace in terms of basic strategies that are life-saving. Vaccines should not be a political thing. My daughter just started college and they said, you cannot ask anybody if they're vaccinated. That's political and that's not nice. Like, what is that? It's a medical intervention that saves lives, is why I've never treated a kid with measles, because everyone gets the measles vaccine and now it's become right. And so that we can do the things that are important to save people's lives and livelihoods.
Well, and it seems to me that there's a strange way in which this has been good for public health, if you will, in that now it's time people recognize the importance of having vital, viable public health departments. And hopefully there will be more public information and education. Hopefully there will be more work at the community-based level to help people understand the importance of not just vaccinations, but the science, if you will.
You're right, Ms. Maureen. We have to think of, turn the lemons into lemonade and see that silver lining. Who knew? Everybody, I think, thought an epidemiologist must have been some kind of skin doctor, like epidermis, or now everybody knows what an epidemiologist was. I think everybody's gotten a makeshift Google degree in epidemiology and public health. And so I think just understanding how important that field is, I think a lot of people are going into the field. So we're going to have more public health champions that will help us prepare for, regular crises and the next big ones.
Well, and just as an aside, I'd like to tell all of the hundreds of people who are listening and watching that we thank you for submitting so many questions. I'll do my best to try to get to some of those at this point. And to ask what is my next question, what does it mean to you to have so many people? And what does this mean to you personally, to have so many people, even healthcare providers, refuse to accept the vaccine?
Yeah, so I have evolved, because at one time it was just pure frustration. And now, again, and this is, I think this is, divine wisdom to say, we have to have compassion for everyone. That's what Jesus wants, that you have to have compassion for the unvaccinated. Behavior change is hard. I have been reading up on what are the ways to try to get people to change. I was looking at all the articles on the opposition to seatbelts once upon a time. I was looking at the opposition to thinking that you can't smoke in a public place. So that took time. Anything that you start new is a shift. And so not everyone will adopt change at the same time. You have people that are rapid adopters, some people who are like, let me watch what you do. And then some people who take a much longer time for whatever reason. And there's a lot of different reasons. And so I've just been focusing on being compassionate and be compassionate and make that encourage me on new ways to educate and new ways to support, because I think, I think the truth will become more and more clear. And the fact that 8,000 people every day still get that first shot, like 8,000 people got their first shot yesterday. Mm-hmm. So it's not lost. People are saying, wait a second, you're talking about getting a third shot. Maybe I better get my first shot. And so I'm encouraged that sometimes it takes longer than we want. And obviously we'd be better off if everybody on day one was like, I get it, I'm going to do it. But, change is hard and everyone goes through their process, and we have to respect that evolution and just stay patient and know that you're not going to win people over with anger or animosity or harsh words. It's always going to be with love and kindness that people will even think about listening to you, because you're talking respectably and kindly, and then they actually even have the opportunity to listen to what you're saying.
Gosh, I'm in awe of your gentle approach, your gentle, loving approach. I think you're right. And in the midst of a pandemic, I admit to feeling frustrated would be a very gentle term by people's hesitation. And I appreciate where you are. It brings me to another question that came up from more than several people with us today. And that is, do you have any information on the status of the Moderna and Johnson & Johnson boosters?
Yeah, so we do know that, Moderna came out several weeks after Pfizer. And so, just the amount of time that they need to collect their, research data. But I think we know that they are compiling that and should be submitting it to the FDA, if not, next month. Very shortly, we're already in October. It may be in this month or next month that they might be sending their research to the FDA for them to weigh in and decide if they can get those boosters. And I think J&J is also working on that. Again, J&J has not been given in the same quantity, so it means you need more time to gather more data. But I think all of those studies are underway, and hopefully, I know it's not satisfying for those who are sitting and waiting, but we know it's coming, and people can just take the basic practices to keep themselves as safe as possible in the meantime.
And so to follow up, there are also several folks who are asking about antibodies and how long post-vaccination or even post a case of COVID, those antibodies are protecting us. Can you expound a bit on that?
Yeah, so I think that's the reason. Immunity is complicated. It's really not just about the antibodies, but that is something that you can measure and check the levels. And so following those levels, the reason that the FDA and the CDC approved the boosters or the extra doses is because they have seen, but particularly in certain groups, that, starting maybe around 6-8 months, there may be some dropping off of the antibodies. It doesn't mean that, all of a sudden after 6 months, you're not protected anymore. The truth is, there are lots of people that were vaccinated in December and January and February. They're all well past six months. And so they were probably exposed to this Delta virus because it, in its heyday, at the end of August, at the very beginning of September, it was just everywhere. And the case rates were through the roof. And the fact that all those people didn't end up in the hospital meant that vaccine was working. But we have identified that in higher risk individuals, people over 65, people with significant medical problems, if there was somebody who was going to start to see some more lowering of that protection, it was those individuals. And so therefore, boosting those people will up that antibody level, I think maybe up to 10-fold, up that antibody level and give more protection. So again, I don't want everyone to think who has been vaccinated that I'm completely susceptible, but we want to just fortify that protection, and we have these supplies with which to do it.
Again, a follow up, and this is another one of the questions that came through from several different participants. But the question is, so if you've got only, according to a recent piece in the New York Times, if you've only got the chance of 1 in 5,000 of contracting COVID, and 1 in 10,000 if you're in a highly vaccinated area, can you just speak very pragmatically about risk factors?
So what are some of the risk factors? So there are personal risk factors in terms of medical conditions one may have. There are some risk factors you can't do anything about. Being over 65 for COVID is a risk factor. There's not a lot you can do to adjust that. Having a heart condition or uncontrolled diabetes, actually being pregnant is a risk factor. And so it is very clear that people who are pregnant, want to get pregnant, who are lactating should get this vaccine to protect both themselves and the baby. People who have kidney problems, cancer patients, anyone who takes medicines like steroids. Steroids depress your immune system, so it makes you immunocompromised in a way. So there are so many conditions that if you think that, if you know you have it, you want to be aware that, there's a little bit higher risk. But then you also have to think of high risk settings. If I have a job where I only work in my office, in my home, live alone, nobody comes in, that's a much different situation than someone who says, I go door to door selling insurance, sitting down with strangers and talking to them about insurance, or I work at a grocery store, or I work, as a masseuse, or so you have to think about a high risk setting, where you're exposed potentially to lots of people, and then also think about your maybe risky conditions or medical conditions and put that into your calculations.
And turning to, I don't know, sort of a personal perspective for all of us, what about large indoor settings? Do you, Dr. Ezike, dine indoors? Would you go to a family wedding that was indoors, where you might not be sure everyone is vaccinated? How do you personally mitigate that sort of circumstance?
Yeah, so I have to think a lot, right? And especially I've been so terrified of becoming the headline in terms of, she is the cause of a super spreader event, So I remember I wanted to have a party for my son graduated last year, there was no graduation party. My daughter graduated this year, and I'm like, you know what, we're going to have something, a combined, it's 2 years of graduation celebration. And so thinking through how to do this as safely as possible, we did decide it was outside. So it was outdoor, and everyone had to send their COVID vaccination card. They had to be fully vaccinated. And people called and were like, and there was like a Google document, we had to upload it ahead of time. And as it got close to the event, the ones we didn't have, we were reaching out and calling. They're like, oh, you were serious? It's like, of course I'm serious. And they're like, oh, well, what about my 10-year-old? I said, find a babysitter or stay home, but we're not doing this, So it was very clear. And luckily the weather cooperated, and we had a beautiful outdoor gathering. But my brother did get married in this time after putting it off. He finally got married. Same thing. It was indoors. Everyone had to submit, proof of vaccination. It had to have that ahead of time, and it was kept very small. I do go to restaurants. If I have the outdoor dining option, I'm always taking that. If it's not, obviously I'm really only, is that, I guess it's discriminatory, I don't know, but I'm only hanging out with vaccinated people. And so, if I go to a restaurant, all of us are vaccinated, we will eat, we will take off our masks. I haven't figured out how to eat through a mask. So we will take off our masks and eat, out of, respect to the wait staff. I will put my mask on anytime the wait staff, I'll tell them, I am vaccinated, whatever you want to do. So I'm just trying to be very deferential and make sure they know that I'm trying to be respectful of them. So I do try to avoid indoor gatherings. We were invited to a wedding in Dallas, And we went to Dallas. It was a very close family friend. And I was shocked when I walked in to the church and nobody was wearing masks. And I was like, this is a little risky. So, I had to switch from just a cloth mask to a more medical grade mask because I was a lot concerned. So there's those kind of things. And so as soon as, the church was over, we tried to do everything in the outside, in the foyer, which was outside. And then I was going around to people who I knew and I'm like, what are you doing? Where's your mask? And they're like, oh, well, nobody else had it. So I said, put your mask on. So sometimes the peer pressure, it goes both ways. And some of these people were doctors. I'm like, are you kidding? They're like, I know, I have my mask here. And then they start fishing around to get it out,
Well, do you foresee a time when we won't need to wear a mask? And is that time anytime soon?
Everybody should make their appointments to get them surgically attached. No, kidding. No, we will absolutely get beyond this. But I think there are many people who are going to say, maybe if you have if it's flu season and we know that flu causes a lot of illness and you have a heart condition or you have bad lungs, you might say, this might not be such a bad idea in crowded settings and indoor settings, that I'll put my mask on because I really don't want to catch the flu and end up hospitalized. I maybe don't have a problem myself, but I take care of my mom and she has cancer. I don't want to take the flu back to her. Maybe, so I think there will be some long lasting changes that might result, but I don't think there will be an indoor mask mandate from the governor forever. And we've actually been talking recently about what would be the criteria for taking off the mask. And then when would you need to take it on again? Because no one can say, except the man above, when the next variant, if and when it's coming and what it's going to do, and will we need to go backwards? And so we can say like, oh, maybe we're going to get close to the point where we take it off, but also plan that if X, Y, and Z happens, we might have to go back to it temporarily again.
Right. I've got so many questions and I know we're running short on time. There were several questions from teachers, just any good advice about how to keep kids safe and schools open, especially kids who cannot yet be vaccinated.
We are getting more and more data, and we're going to be releasing some of that data as we cull it and get it together, that if kids are masked in school, if they're not even 6 feet apart, maybe not even 3 feet apart, but if they're masked in school, we are not going to see a lot of transmission. And so really the best way to keep kids in school and avoid the virtual is to just make sure that kids are masked. And so that is a simple thing. Kids, under 11, 11 and under don't even have a chance to be vaccinated, but we are seeing, the teachers, please get vaccinated. That's a way to help protect the kids, and then have the kids masked. That will absolutely protect the kids until they can get vaccinated or until we get beyond this pandemic.
Do you foresee a time when vaccinations for COVID will be mandated?
I mean
we have
they are
mandates
now
for other vaccinations.
Yeah.
Yes.
No, absolutely. Yeah. I think once we get past all this crazy time and we start thinking more just as real scientists, measles vaccine is mandated. You can't go to school without it. You can't go without your polio vaccine. If it becomes something where COVID just stays with us forever, that will likely be added at some point, maybe to the pediatric schedule. But we have to let it all get approved and get formally approved like the other vaccines were, and then then we should just treat it like the other vaccines.
And do you anticipate COVID being with us for forever, or some form of COVID being with us forever?
So. It looks like there aren't many respiratory viruses that we have ever completely eliminated, right? Like the SARS and the MERS, the Middle Eastern respiratory virus, the one out of Asia, like they're still around in low levels. So it is hard to completely wipe out a respiratory virus. We haven't wiped out flu. RSV, which happens to kids, happens every year. So it's a little unrealistic. Ebola is still I mean, that's not more so much as respiratory, but so a lot, it's hard to completely eradicate something. So it's more likely that it'll be with us, but we will be able to control it. There is a medicine that's in phase 2 trials, an oral, maybe 5-day treatment, you know, that they're saying, would it be for prevention or for early, after early detection? So things will change, you know, we will evolve in this pandemic where we are living with it instead of, you know, living in fear from it.
And I have to say that I'm not a scientist, but wow, how exciting has it been to see how quickly we've been able, from the science perspective, evolve, move, create new vaccines, protect the larger community. Again, what a great day for people in the world of science. And I hope that it encourages more and more kids to pursue that in their careers. I do have another question. Oh, and I know we're running, I have so many questions, but looking ahead, can you stay for another hour? Looking ahead, no, I know. Looking ahead, where are we headed? What do you see over the next month or two, the holidays, the next 12 months? Can you give us some
hold on.
sense?
I'm just going to go grab my crystal ball and tell you exactly what's happening.
I knew you were going to say that. I almost said, do you have your crystal ball? Or, no, you know, I mean, that direct line, you know.
I think one of the things that I've had to get certain about is that there's a lot of uncertainty. I have to get comfortable with the fact that there are a lot of uncomfortable questions that I can't answer. But what I can say is that we're going to be prepared to react. But unfortunately, there's a lot of reacting to what happens. I didn't know there was going to be a Delta variant that would come, you know, at the middle of summer and complicate what I thought was going to be a beautiful summer. I was worried about the fall when we went back into indoors and it got cooler. I didn't know they were going to mess up our summer. And so again, there are curveballs. Who knows where the next variant will come out of? Most of the world is completely unvaccinated. The underdeveloped countries are like 3% vaccinated. My father's homeland is like 2 or 3% vaccinated. So that is also an opportunity where, you know, if we don't change that around, and the whole world needs to put their arms around the rest of the world, the underdeveloped world, and get them vaccinated. We are only going to be as strong as the weakest country out there and the lowest vaccinated country. And so those efforts need to be strengthened to make sure that we are looking at this globally and not just, you know, individually as a state or as a country.
Absolutely, absolutely. And before I let you go, I guess, there are so many questions I didn't get to, and I apologize to all of the folks who sent terrific questions in. I didn't get to them. However, I do just want to ask any call to action to the hundreds of people who are watching, listening, any final words before we officially close out?
Yeah, no, I would say stay positive, stay prayerful. I think we need a lot of reflection. We need to learn how to better interact with our fellow neighbors and our communities. I think we've had multiple pandemics within pandemics. We've had the issue of racial justice. We've had the pandemic. You know, all of these things really need to help us focus on how do we interact with our neighbors? How do we support one another? You know, so I think it's an important time to think about these things in terms of the pandemic. If you're not vaccinated, please get vaccinated. And if you are vaccinated, don't stop there. You take those people that you care about and make it your mission to educate them so that they get vaccinated too. You don't want to be at their funeral. You want to be able to celebrate with them. So it's important that you get your friends vaccinated and not just let it go and say, I don't want to get political. It's not political. It's loving on them and wanting them to be safe. And you have to stand up for things that are important to you and people that are important to you.
I cannot tell you how grateful I am, not just for your participation today, but much more importantly, for this personal perspective you shared with us. Again, you continue to be just an inspiration to me, and I know to so many, with your heartfelt, caring, compassionate, I keep saying compelling voice of reason, and your huge heart, your huge heart. So I know that everyone, again, listening, watching, wishes you Godspeed, all good things. Thank you, thank you, thank you. And with that, I turn it back to the Padre, the birthday boy, our founder and chaplain, Father John Cusick. Thank you, Dr. Ezike. Thank you.
Thank you, Ms. Maureen.
Dr. Ezike, if we were in the Union League Club, as we've been for 34 of our 36 years, at this time, people would jump out of their seats. They would stand tall, slap those hands together, and make you blush, because you struck a chord within me today. And one of the things that hits me the hardest here is what makes me sad is that we're losing a sense of a communal responsibility. It's not about me and my rights. My rights are only good when I'm in relationship to you and to people I've never met. I grew up in the Catholic tradition, and we had a thing called the common good. We have to participate in the commonality of life. And right now, when you talk about 3% of the world, well, that's just not a statistic. That's the world. And we live in a worldwide economy. We live in a worldwide sense of community. And if we don't get this thing under control around the world, then I think I feel sad, because that's our role right now, because that'll help stop this thing too. The answer isn't let's close the borders. The answer is let's heal the world. And I think we got to dream big, think small, and go slow. Well, we've done the go slow, we've done the thinking, but now we got to keep dreaming beyond the top of the tree.
Amen.
We'll always land on top of the tree, but we've got to shoot for the sky. But thank you for your inspiration, but your knowledge, your skill, and your professionalism as a physician to remind us of what has to happen. Thank you.
Thank you so much. What a pleasure to be with you this afternoon.
And be blessed in all the great things you do. Keep inspiring us.
Thank you.
Thank you.
Thank you.
Have a good weekend.
Thank you. You too.
Okay. And
Happy birthday.
Thank you. Before we shut down, our next month, we're getting together on the 5th of November. And we've got two wonderful people with us. Shaka Rawls is the principal of a great small all-boys high school on the south side of Chicago, Leo High School. And he will team up with a person whose name we've all seen and read her work, Heidi Stevens, who for a long time was with the Chicago Tribune. They teamed up 5 years ago and they found a shared path to deal with the violence that plagues our city. And we've got two pandemics, I think. We've got a medical pandemic, but we have a pandemic about life. We can't keep killing one another. We can't keep the fear of COVID is now with the fear of where can I go in Chicago and not worry about getting shot. So we're going to deal with that next month, and that's going to be on the 5th of November. If at all possible, we don't know. We'll know in another week or so. We're going to try to be at the Union League Club. If not, we're going to crank up the old live stream and the wonderful thing and get behind the camera and do it this way. But stay with us, help us, support us. And again, Dr. Ezike, have a great weekend. Bless you.